Hi, everyone. Welcome to another video by Pearson Clinical Assessment. My name is Tina Eichstedt, speech-language pathologist and senior product manager for us here at Pearson. Today, I'm very happy to bring to you a conversation I'm having with Dr. Dave Corey, who is a private practitioner in Oregon and is board certified in both forensic psychology and police and public safety psychology. And he comes to us as a co-author with Dr. Yossi Ben-Porath of some recent guidelines for administering the MMPI tests via remote on-screen administration through Pearson's Qglobal system. So welcome, Dr. Corey.
Thank you. Good morning.
So we're going to take just a few minutes this morning, and I just wanted to ask Dr. Corey a few questions about these guidelines and really the application and implications of those guidelines on current practice. So Dr. Corey, tell us a little bit about the guidelines that you and Dr. Ben-Porath drafted about the MMPI tests remotely, and tell us what's in those guidelines.
Sure. The guidelines link to a number of other guidelines published by the American Psychological Association and other resources that are useful to any practitioner in understanding the challenges and issues that one needs to consider when engaged in remote administration of the psychological test. But the focus of these guidelines in particular is on the importance of preserving a testing context that as closely as possible matches the context into which the normative data or comparison group data and research findings were established. You know, the foundation for that research is a testing environment that is free of distractions and that is conducive to a test-taking context, and that allows you to ensure that the person is engaged appropriately in the task. There are really fundamentally two ways to do that. One is through the use of a on-premises monitor or proctor who aids the individual in logging in and getting connected to the test, ensuring that they're appropriately engaged in the task, answering any issues, including technical problems that they might be having, reporting and resolving any technical problems, and ensuring that the context remains free of distraction, and very importantly, ensuring test security.
Right.
There are two ways to do that. One is to have the monitor. The other is to monitor the testing session remotely through encrypted, HIPAA compliant, appropriate video technology. So in my own practice, police and public safety psychology, we have real challenges today. California, the entire state, is in essentially lockdown. And yet police and public safety, police, fire, corrections, they all need to continue to select, hire, and bring on, now more than ever, new candidates. How to do that, of course, is the challenge, while maintaining all of the issues that I described in terms of the context of the testing. So what this allows them to do is to, if they can come into the public safety agency and be proctored by one of their personnel, terrific. If they can't, the psychologist can monitor it, or the psychologist staff can monitor that activity remotely.
Great. And so many things to take into consideration, as you said, that you've put in the guidelines to really help practitioners make those decisions about how to manage that remote administration in the best way possible. Tell us, Dr. Corey, what's not in the guidelines?
What's not in the guidelines are the specific requirements that any individual state may have regarding informed consent and disclosure, regarding authorization, regarding recording of sessions. All of those considerations are unique to a particular jurisdiction and have to be considered by the practitioner. They're usually available and fairly easily found on the website for the licensing board relevant to the particular practitioner.
This is a great opportunity for clinicians and professionals out there, and we just thank you so much for your time today.
You're welcome.